My name's Lewis Bates. I'm a clinical fellow in medical education at Pinderfields Hospital. My work mostly involves teaching 2nd to 5th year medical students with some simulation work and lots of ward work as well, and I work mostly on MAU and A&E. Talking today about junior doctor-led opportunities to provide feedback to students. The GMC highlight just how important it is to provide students and trainee doctors with feedback, and students often complain about not getting enough feedback. Students get observed much more frequently than doctors do once they enter training, and it's important to make sure that you get those observations of skills in before you start working on the wards. I want to talk in this video about how best to give students feedback. I always ensure that I've asked students prior what it is they want to learn. Some students will have books with a checklist of what they need to learn on that placement, but otherwise I just make sure I've had a conversation so that we know what they want to learn. Start by preparing and agreeing the encounter that's being observed so that both parties know what's being assessed. Make sure that you do actually observe the student performing the behaviour or skill. This can be difficult on a busy ward, but you can't provide proper feedback without observing the actual skill in question. Busy wards can make this difficult, especially if you're pressed for time. Make sure that you do try and find somewhere quiet so that you can have a one-on-one conversation with the student. Make sure that the students are ready to receive the feedback as well. It can sometimes seem forced, but preparing the students and telling them that this part of the session is about feedback can be important and ensures that they are ready for what you're going to tell them. Make sure that you give the key, positive as well as constructive comments. It can be difficult to give students constructive feedback as it can come across as too negative, but the constructive comments are the ones that students will really learn from, and students will be grateful to you if you can be honest and candid with them about where they need to improve. The most important part of giving feedback is making sure that you leave students with an action plan. And an action plan is really a set of ideas or plans as to what they need to learn to improve themselves. The mini-CACs is a very useful tool to use on the ward. They're quick and easy to fill in on people's phones. It provides you with a little bit of structure to provide your feedback and think about what to tell the students. Whilst they are used to assess the students, it's really important to think about them as a learning opportunity. Used properly, they're a really powerful tool to help students learn and reflect on what they've just done. So the most important parts of giving feedback to students is that you need to agree prior to giving it on what students are going to be assessed on. Allocate a significant chunk of time for giving feedback after the skill or behaviour, as that's where the students will really learn. Make sure that you include the constructive feedback as well when you're giving feedback. Finish up your feedback with an action plan, an agreed plan of what the students need to learn from that procedure to improve. The mini-CACs is a really useful tool to use on the ward, but remember, it's not just about assessment, it's a learning tool to help students improve.